Swadika and good afternoon. And this is the English language summary of the press briefing on the COVID-19 situation in Thailand, broadcast live from the Center for COVID Situation Administration, or the CCSA. And today's briefing is for Friday, the 27th of August, 2021. And I'm following the very important briefing from Dr. Apisamai Sirangsan, the Deputy Spokesperson for the CCSA. And today she briefed us on a very elaborate plan that was planned today at the General CCSA meeting that the Prime Minister chaired earlier today, which is a very important meeting because we had to review the current public health measures and disease control measures that are in place right now and that are effective until next Tuesday, the 31st of August. And therefore, there was a need to review the current measures and how we're going to be moving forward. And I will be going into detail about these measures later on. Now, allow me to start to talk about the general statistics and the reports of newly confirmed cases for today first. So we have on the screen right now the numbers of the newly reported cases today. We have at 18,702 cases. And this is, I'd like to note that this is the sixth day where we have witnessed new confirmed cases below 20,000. Now we have today new recoveries that again exceeds the number of newly confirmed cases. New recoveries stand today at 20,163 persons. And of course, for the new fatalities today, they stand at 273. I'd like now to turn your attention to the current figures that we have for the national vaccination rollout. Yesterday, we administered a very good number of vaccines, standing at 669,189 doses of vaccines. And this means that within that number, 400,618 persons have received their first jabs yesterday. 263,299 have received their second jabs. And there are about 5,000 who have received the booster doses, which are reserved only for medical professionals and frontline workers. And so therefore, we have an accumulated total standing today at 28 million doses, almost 29 million doses today, covering the total population in Thailand. Now, for some observations of the current situation in Thailand for COVID-19, we see that the number of new infections countrywide has been on a downward trend. And of course, the exception, however, is in the northeastern part of Thailand right now, which is caused by the movement of some COVID-19 patients who have opted to return to their hometowns to receive medical attention and treatment. And as the overall outlook for the number of fatalities and new infections of COVID-19 have seemed to be plateauing both at the global level and in Thailand, in recent days we've seen an ongoing decrease in new infections across the country, as the number of daily discharges has also exceeded new infections, and many additional beds have been made available to new patients who have moderate to severe symptoms. And so this, we hope, would help prevent new fatalities as well. So the next goal that we have then that we are aiming to achieve, therefore, is to gradually adapt ourselves to the new public health measures as we learn to better coexist with COVID-19 instead of entirely focusing on eradicating the virus completely. This paradigm shift is the rationale behind today's deliberation of the newly adjusted public health measures by the CCSA General Meeting today, chaired by the Prime Minister, as I mentioned earlier. We also have an overarching concept to consider the adjustment of current restrictions and disease control measures, collectively referred now to as the smart control and living with COVID-19. So what are these new measures defined as? Well, these new measures, these smart control and living with COVID-19 paradigm means that we are preparing the country for a gradual return to the new normal, whereby we will learn to coexist with COVID as we continue our daily lives as normally as possible, but also as safely as possible. And these new measures stem from the fact that the majority of those infected with COVID-19 tend to exhibit little to mild symptoms, except those over 60 and those other at-risk groups with pre-existing medical conditions and pregnant women who might require special medical attention and hospitalization. And part of the adjusted measures will include the avoidance of hosting activities in the 3 Cs that have the potential to lend themselves into new clusters. Now, what are the three Cs? So the 3 Cs are, first of all, crowded places, secondly, close contact settings, and thirdly, confined and enclosed spaces. Now, another part of the new adjustments will also aim at adopting practices to reduce the risk of new transmissions and to control the disease, including the use of antigen test kits for crowded communities, markets, and restaurants, and active case findings to be administered in fragile communities or areas by CCRT teams and other, I'd say, other volunteering groups as well. And also very important is the early detection of new infections through the use of antigen test kits or ATKs, and the use of effective home isolation and community isolation schemes, as well as the use of bubble and seal measures for factories, workplaces, and construction sites. And these measures will be conducted in tandem with the national vaccine rollout that we hope will have achieved the 100 million doses and the 50 million people benchmark, or 70% coverage of the entire population having received complete doses of vaccines by the end of December this year. And as we mentioned earlier, the administration of 500,000 doses of vaccines per day is progressing steadily, with priorities given to at-risk groups, 70% of whom will have already been vaccinated by the end of October, and more than 50% of the entire population, including children, will also have been vaccinated. And as for the adjustment of measures, which in general means the easing of some restrictions for interprovincial travels and public health measures for restaurants and eateries, as well as shopping malls and other business operations, through the adoption of new requirements, such as the use of ATKs and vaccination requirements in the dark red zones or the maximum controlled areas, which is to begin on the 1st of September. This will eventually become standard practice by the beginning of October, meaning in business establishments and areas that have been successful, this will become standard practice and expand gradually. And in effect, this also means that businesses and organizations that are ready and willing to comply with COVID-free settings and these universal prevention guidelines may resume their operations as of next month or September. And in terms of public spaces, the new measures will emphasize physical distancing, the provision of good air circulation and ventilation, and strictly observing public hygiene. Also, employees working on-site in business establishments must be vaccinated and take weekly antigen test kits. And for those who are going to be customers and reside in the dark red zones or the maximum control areas who have received full vaccination will be given green cards, and those who have previously contracted COVID or those whose ATK results within 1 week is negative will be given a yellow card to indicate that they may enter restaurants or have access to some of these business activities. So businesses and restaurants in other zones may comply with DMH TTA measures and the Universal Prevention Guidelines. So let me get into details about the adjustments of measures in the dark red zones, which were discussed at the General CCSA meeting this morning. So these adjustments of measures will start on the 1st of September. First of all, on interprovincial travel, these restrictions are now eased, and it's permissible to travel across provinces when and if necessary. Public transport can operate at 75% capacity, provided that masks are worn at all times and there is no consumption of food and drinks. Vans and buses should stop to allow for air circulation every 2 to 3 hours. And workers who travel to work must follow a sealed route under the bubble and seal measure. Secondly, on the opening of restaurants and eateries, those restaurants situated outdoors or those situated indoors but who have no air condition and have good air circulation or ventilation may seat up to 75% of their maximum capacity. For indoor restaurants with closed settings or air-conditioned settings, they may seat up to 50% of maximum capacity. And all restaurant operators must strictly follow public health measures and, of course, personal hygiene. Now, thirdly, on the adjustment of measures for community malls and shopping malls, so all shops situated within the said premises can operate as per normal, but with limited services. These are beauty salons and beauty parlors, which may only open for haircuts with a maximum duration at a time of only 1 hour per customer. For massage parlors, they can only open for foot massages. Beauty clinics may only sell products but not give services. Restaurants and eateries may open for business, given that they comply with measures for restaurants and eateries with air condition. So these must use the rules for restaurants with closed settings. Now, there are some businesses and activities that are not yet allowed to operate normally for the time being, and these are tutoring schools, cinemas, movie theaters, spas, amusement parks and water parks, as well as conference centers and dining halls. So all of these establishments within shopping malls are not allowed to operate as normal yet. For fitness and exercise and sporting facilities outside shopping malls, these are allowed to be opened only for exercising purposes. They are not allowed yet to operate for events with an audience. Now, on schools, as Dr. Pisamai mentioned right now, schools remain closed for the time being, but the use of school buildings can be permissible given that the appropriate and the relevant authorities concerned have reviewed and approved the use of such school buildings. And of course, these include the provincial education authorities and the communicable disease committees, of course, also the Ministry of Education and Ministry of Higher Education, as well as the Ministry of Public Health. And as we have always stressed many times, the success of all of these measures is dependent on the cooperation of all sectors to conform to these new universal prevention guidelines, and it's very vital to the success of our whole society and country to open up as our ultimate goal. Now, so allow me to recap once more. The universal prevention guidelines include leaving your place of residence when and if necessary only, observing social distancing of at least 1 to 2 meters, wearing cloth masks over surgical masks, even when at home, washing your hands frequently with soap or alcohol gel, avoiding touching your nose, eye, or mouth, separating personal items and dining utensils from other family members, and testing yourself with antigen test kits as often as needed. And remember that ATK test kits for COVID testing is now available over the counter in drugstores. All of these measures are subject to review in accordance with the changing situation of COVID-19 in Thailand. So I hope I've clarified these measures and explained them well enough to you, but of course you can look up more information and of course look in the social media accounts that we have for our CCSA social media accounts, and also send us queries if you have any. I hope that you all have a safe weekend and remain at home as much as possible. We hope that all of these measures are a good start to a reopening of our country very soon. And so we will be back again with another briefing on Monday. Thank you again for your very kind attention. ขอบคุณค่ะ สวัสดีค่ะ
ครับขอบพระคุณนะครับ